So for dry needling, we're trying to focus on specifically, as she can feel, nodules or knots. These are adhesive muscles where they're kind of stuck in locked position. They're not very functional, they're not moving very well. So the point of the dry needle is to go into these tissues, called the mechanoreceptor reset. Reset the actual muscle, the myosin act in the moving parts of the muscle. This is what the needle looks like. Very small, it's about 3 times the diameter of a piece of hair. Hard to see in there, but very small needle. So we're going to areas of dysfunction. It'll help stimulate blood supply. Moreover, it helps with the function. It does do a little stimulation for the collagen. But right here, she can feel this. It's a big knot right there.
Oh, yeah.
So we apply this, the tube, reset by tapping. So the patient's going to feel a tap, and usually just pressure. So you're going in when this little mechanism like this resets the muscle. I can feel it relaxing based on how the needle feels. Patient sometimes feels a twinge or twitch response.
Yes.
Which is the muscle releasing. And then this release process, we start the release process, and for the next 2 to 3 days, it goes through a resetting of the length. It's a calibration phase. A common area we treat in patients is a lot of the levator scap, the trapeze that comes through here, sometimes rhomboids, but most people that sit down at desks, look at computers, all those things, these muscles get strained because it's trying to hold up the head and neck, which is very heavy when the head's in forward flex position or posture. So this is the levator scap head right there. A little bit of the superior trap up in there. So this is great for patients that have knots in their shoulders. Like your spouse, husband or wife, or your good friend, you're like, hey, rub my shoulders because they hurt. So when they feel nodules, this is the muscles that are stuck in locked position. So they lose their functionality because they lose their ability to calibrate length. There's something called the muscle spindle fiber, which is a little teeny ruler in the muscle. The nerve connects to the muscle and it knows how long it is. So it knows that it can shorten and then come back to relaxed position. Also the Golgi tendon organ, which we can treat those as well. That's another little teeny ruler that's in the muscle meets the bone. There's a tendon inside that. It's called the Golgi tendon organ. We can also work on those. So basically feeling along the muscle belly. This would be the bone. This would be the other bone. Muscle belly is in the middle part. So we're feeling along this longitudinally, then perpendicular. Find a little nodule like right there. Come in. Helps to tent the tissue up so we can get right in. We go right past the fascial plane, right into the muscle like that. She can feel it kind of jumping and twitching.
Yep.
And that side is done. Now when I palpate through the muscles, it feels less rigid. It's really smooth. In comparison, this whole area over here, palpating goes clunk, the big old knot right there. My palpate over, it's just clunk. Right there, you can feel that.
Oh, yeah.
Versus the other side that we've now treated. See, still a little rigid because she's had these tight muscles for years and years. Let's go right there. jumpy one.
That was a big jumpy.
That's a twinge or twitch response. That resets the length of the muscle.
And it does not hurt. Just feels a little
Pressure, usually.
Yeah. Well,
it's a very unique feeling. It's hard to describe it. It's more, or best, felt experience. There's a really tight one right there. Really angry one. There we are. Sometimes the very, very restricted muscles, it will bend a needle. And then we'll get a new one. And this area is paraspinals. For her, it's on this side here. And there a little bit. We'll see the right side though. In here. That's it. Complete.
Thank you.